Hey, what's going on, you guys? If you can hear me, please, by all means, put a one in the chat so that I can know that y'all can hear me. I am trying to set up my new system and bring some news to the airways. So please, by all means, peoples, come on through. Uh, please come on through. Thank you for joining. This is the current situation in the state of Maryland. For those who do not know, that don't live here, or who do live here and have not gotten a notification. Hey, Shan, babe. Hey. Um, I haven't been making videos in the last couple of days because it's been a lot of stuff going on here in Maryland. Um, coupled with day-to-day life, I've been going to a lot of doctor's appointments and stuff like that. But currently, right now, as it stands, they are closing all schools in the state of Maryland um, this coming next week, and it will be closed for 2 weeks due to the COVID-19 virus. Um, the Governor Hogan, he just did a press conference, and they have enacted the National Guard down here. I'm not sure what's going on in everybody else's state, but this is what's going on in the state of Maryland. Um, School's gonna be closed. They is not taking this lightly. I think it's about 11 confirmed cases, between 9 or 11 confirmed cases in the state of Maryland. So they are not taking anything to spare. They have essentially cut off all you know, public activities where it'll be large gatherings. As I said before, all schools in Maryland will be closed for the next 2 weeks. Going forward, I don't know how long they're going to be closed, but I do know it is a definite for the next 2 weeks. I'm about to play this video, and this is going to be a short live, you guys. Because to be honest with you, I just been doing a lot of running around, getting stuff together, getting stuff prepared, doing my best to combat this COVID-19. Without further ado, I'm about to play this. Please listen and listen carefully. Uh, Governor Hogan is not playing around. And hello to everybody that's coming in the chat. Let me know if y'all can hear that.
Joining me are Lieutenant Governor Boyd Rutherford, House Speaker Adrian Jones, Senate President Bill Ferguson, Maryland State Superintendent of Schools Karen Salmon, Deputy Health Secretary Fran Phillips,
Right, Shan.
Major General Tim Gowan, who's the Adjutant General of the Maryland National Guard, Dr. Mohan Santha, the CEO of the University of Maryland Medical
Hey,
System,
Keisha.
Kevin Sowers, the President of Johns Hopkins Medical Health System, as well as several members of our Maryland Coronavirus Response Team, Dr. William Chen from the University of Maryland, Baltimore, Dr. David Marcosi from the University of Maryland School of Medicine, and Steve Evans, the Executive Vice President of MedStar Health. Earlier today, we confirmed the first case of community transmission of COVID-19 here in Maryland. The individual is a Prince George's County resident who is currently hospitalized. Unlike Maryland's previous cases, this person had no known exposure to the coronavirus through travel or through another known infected individual. The The circumstances of this case indicate that we are entering a new phase of this crisis in our state. We should expect the number of cases to dramatically and rapidly rise. Our primary focus is now turning from containment to aggressively working to mitigate and limit the spread of the virus. Just yesterday, the World Health Organization declared the coronavirus outbreak to be a global pandemic. More and more countries and states here in America are struggling to grapple with this crisis. I want to again assure Marylanders that all levels of government have been preparing for this for many weeks. But we have moved into community transmission in our state, and we believe that all of us need to take serious actions to limit day-to-day interactions and activities.
Right, Keisha.
We all need to do our part to stop this virus from spreading.
But Hogan ain't playing
This
with him.
afternoon, I met with the leaders of the General Assembly, Speaker Jones and President Ferguson. And a few moments ago, we had another emergency meeting of my full cabinet. At the advice of our entire leadership team and our coronavirus response team, we have made the decisions to take the following major actions in order to protect public health and safety. Effective immediately, I just directed the Maryland Emergency Management Agency to move to its highest activation level in order to mobilize all available state resources to respond to this threat and fully coordinate response resources with county and local officials. I have just enacted an executive order to activate the National Guard and move the Guard to a higher state of readiness in order to carry out any necessary functions and critical areas of need in the coming weeks. Also effective immediately, all state government is raised to elevated level 2. Effective immediately, all non-essential state employees who are approved for telework will be required to telework. Until further notice, public access to state buildings, including the State House, will be restricted. I have enacted an executive order prohibiting any social, community, religious, recreational, or sports gatherings or events of more than 250 people in close proximity at all locations and venues across the state. All planned large gatherings and events must be canceled or postponed. All senior activity centers will be closed until Maryland is no longer operating under a state of emergency. All state and local government buildings and facilities with an expected occupancy or attendance of more than 250 people must communicate the recommendations of the Maryland Department of Health regarding social distancing and provide all occupants and attendees with the capability to wash their hands. I have signed an executive order to close the cruise ship terminal at the Port of Baltimore until further notice.
Y'all hear that?
No passenger or crew member will be allowed to disembark at any terminal at the Port of Baltimore from any passenger vessel that has made a call at a port outside of the United States. The only exceptions to this order are 2 ships, which are currently due to return to the port in the coming days, and which will have to follow all appropriate screening protocols. I have enacted an executive order allowing for the extension of all expiration dates for all licenses, permits, certifications, and other authorizations that are issued by any agency of the state of Maryland.
He's shutting it down, y'all.
Vehicle registrations, professional licenses, and so forth until the 30th day after the date that the state of emergency in Maryland ends. As I have repeatedly said, older people, and especially those with underlying health conditions, are more vulnerable and at significantly higher risk of contracting the disease. We are directing all hospitals across the state to immediately adopt new visitor policies to limit the spread of COVID-19, including including allowing only one adult visitor per patient, prohibiting visitors under the age of 18, screening visitors for flu-like symptoms, and prohibiting visitors with recent international travel. Effective today, all Maryland state prisons will suspend visits in order to protect employees, inmates, detainees, and their families,
Wow.
while our state continues to operate under the state of the emergency. I'm also delegating the day-to-day operations of all non-essential, non-crisis related functions of state government to Lieutenant Governor Boyd Rutherford so that I can focus my full attention on managing this crisis. 2 weeks ago today, at the Maryland Emergency Management Agency, I spoke about the fact that we could expect this virus to cause major disruption in our lives. And just 1 week ago today, I announced our first positive case. As I warned and have repeatedly stressed,
That's off one, y'all. Off one.
And evolve rapidly and dramatically. For Marylanders, the actions that I have announced here today will be disruptive to your everyday lives. And they may sound extreme and they may sound frightening, but they could be the difference in saving lives and helping keep people safe. They do not mean, however, that daily life as we know it should come to a halt. Those businesses that are essential to society and community, including grocery stores and gas stations and restaurants, should remain open. As I've also been saying for weeks, information is changing not only on a daily basis, but on an hourly, almost minute-by-minute basis. And it's impossible at this time to know how long this threat will continue. What I do know is that my first and highest priority is health, the safety, and the welfare of the people of Maryland. I also can tell you that we have the best team of people working around the clock. We will continue to keep you informed, and we will continue to do whatever is necessary to help keep people. And I just want to speak to the people of Maryland directly by saying that we are all in this together, and we cannot stop the spread of this virus without each and every one of you doing your part. But I also want all of you to know that we will get through this together, and that our state has already faced and overcome daunting challenges before, and we will do so again. At this time, I'm going to turn the podium over to Dr. Karen Salmon, who's the superintendent of the Maryland State Department of Education, to make major announcements regarding the Maryland Public Schools.
Thank you, Governor. At this time, I'm directing that effective Monday, March 16th through Friday, March 27th, all public schools in Maryland will be closed. All scheduled school-sanctioned travel for students and staff will also be canceled effective immediately. It is crucial that we take immediate measures to slow the spread of COVID-19 in school communities around the state. During the time of school closure, all public school buildings and school buses will be cleaned and disinfected to prevent the spread of the virus upon the return of students and staff to school. Additionally, I am recommending that days previously scheduled for spring break be used for makeup days of the school closure. Administrators, faculty, staff,
My daughter don't like that.
should begin to immediately prepare for and put into place measures for the continuity of educational services during a prolonged period of school closure. Plans regarding child care services are being developed by the State Department of Education at this time to ensure that the children of emergency services personnel, particularly those who are working in our healthcare facilities, will have access to child care through a prolonged period of school closure. We have started to work immediately to ensure that vital services, such as the provision of meals to students, continue to be provided throughout the duration of the school closure period. Incoming information will be continually evaluated as it becomes available to better inform our decisions about proactive school closures. Schools and state officials will continue to work together to continue to reassess this situation. Local school officials should remain consistent in consistent communication with local health departments regarding the COVID-19. At 5 o'clock today, I will be speaking to all 24 local school system superintendents to work on plans, resources, and supports that we'll be using during this closure. And now I'd like to introduce Fran Phillips, Deputy Secretary of the Public School Services for the Maryland Department of Health.
Thank you, Dr. Salmon, and thank you, Governor. We are encountering now a public health crisis, and it is one that the citizens of Maryland can be assured by the demonstration here that the response to this crisis, this public health crisis, is one that has engaged all sectors of our state government, of our local governments, and certainly our partners, our healthcare providing partners, as well as business partners. This is a public health emergency, and it is one that has a coordinated response, as you will hear, as is demonstrated here today. These are extraordinary measures that you heard announced today, and this is an extraordinary time. These are measures that have been undertaken with a great deal of consideration and with a great deal of evidence. These are measures that are meant to protect Marylanders. These are measures that are taken for three goals. The first goal is to slow the spread of this infection. It is very important now that we have evidence here in Maryland of community transmission that we take the steps needed to separate people sufficiently that we can slow down the person-to-person transmission. And that's important because we do not want many, many Marylanders to become sick and need help and care at the same time. Goal number two is to protect the vulnerable people. And as you heard from the governor, we have enacted directives with regard to long-term care facilities, particularly looking at individuals who are 60 years old, 70-year-olds, 80 years old. These are particularly vulnerable people, and we want to protect them in our community. Likewise, people with underlying medical conditions. Very, very important that we protect those people. But the third goal is to maintain essential services. So as you heard the superintendent say, while the school closure may be disruptive, there will be measures taken to assure that essential workers, including healthcare workers, have the opportunity to have childcare so they too.
Yeah, I'm glad too, Keisha.
Very, very important mission. And that is a mission to protect
I'm so glad too.
of all Marylanders. In a minute, I will introduce two physicians who have been tremendous contributors to the governor's advisory committee on the response to this COVID outbreak. We're very, very fortunate here in Maryland to have the leadership, the expertise, and these world-renowned organizations, healthcare organizations in our state. It's an incredible asset in a moment like this. Before I introduce the speakers, though, I'd like to take a minute and mention our cases, the individual Marylanders to date, 12 of them, who have been confirmed with the COVID-19 disease. Of those 12, 2 are continued to be hospitalized, but I'd like to say that, I'm happy to say, that 3 of those now have fully recovered and have passed their quarantine stage. So that this is evidence that this is a disease that can be properly managed. It's a disease that is very, very serious, and that as a community, we will take very, very extraordinary measures. But again, these 12 individuals, I would like to reach out and to thank them and their families for the extraordinary cooperation that they have given us in the public health community by being open with us as far as their histories, their travel histories, their medical conditions. Very, very important as they were pioneers as we understood as this infection first arrived here in Maryland. That's a public service that we are grateful for, and I know that we are grateful for the future contributions of Marylanders across the state as we adapt to these new and somewhat disruptive measures. So with that, I'd like to first introduce Dr. David Marcosi. Dr. Marcosi is the Associate Chair of Population Health, and he is the lead in emergency medicine with regard to University of Maryland Medical System.
Good afternoon, Governor, distinguished guests, fellow Marylanders. This is a challenging time for our state. I am the incident commander for the University of Maryland Medical System. We wholeheartedly endorse the bold and decisive decisions of our governor here today. This is not about the healthcare system. This is about all of us. We can all fight back against this virus, and in fact, we need to. The healthcare system can treat those who are ill, and across all of Maryland, we are readying ourselves in case we need to. However, by putting aggressive steps in place that the governor just outlined with regard to social distancing, closures of schools, teleworking, these are steps we can all adopt, not just the public sector, but I would also encourage the private sector to adopt the same types of measures that Governor Hogan just laid out. Why? Because the earlier we do this, the more layers we put in place, the less this virus can be transmitted. That's the key. Stop the spread of the virus so that it doesn't affect our young or our elderly. Because if this virus appears to be affecting our elderly more significantly, and then our healthcare system will respond. But if we put these steps in place early enough, we can dampen down, we can flatten that curve, which is what we need to do so that our healthcare system can respond appropriately to the patients who do become ill from this virus. So Governor Hogan, we stand with you, and we look forward to working with you and our state partners for this response.
Okay, you guys. So y'all just seen that um, everything is suspended, everything is closed. Only essential personnel that has clearance to be in public buildings, government buildings, and things like that. Hogan is not playing around. He definitely didn't come to play. If this is a clip note for Trump leadership, get you some. Um, Basically, they closed the school down. A lot of kids not gonna be happy because they gonna have to make it up. But at the end of the day, if it can stop the spread of COVID-19, then I'm all for it. If they gotta be in the house for 2 weeks and not being, potentially exposed to that virus, then I'm all with that. Um, I don't know how nobody else feel, and like I said, I just been doing a lot of running around. That's why I haven't did any videos in the last day or so. And like it just hits close to home because I am a resident of Maryland, and also my mother just turned 60 years old on February the 13th. So it's definitely a concern. Anybody that has family members, older family members, please go check on your family. Please spread the word. I'm not sure what's happening in any other state, but I know in Maryland it is on a lockdown. The National Guard has been pulled up to serve in the state of Maryland and to help out in the state of Maryland. All of the hospitals here are actively working together to come up with solutions to this virus and to better protect people. I went to the doctors yesterday and they just gave me a whole host of list of questions. Have you traveled outside of the country? Have you been in contact with anybody that's traveled outside of the country? Have you, did anything, went on any cruises? Yeah, likewise. Yeah, I am Keisha. I definitely am going to try my best to like be safe and stuff. I went to the store, picked me up some Clorox wipes, bleach, disinfected, Lysol, all of that. I've done what I could do. I even learned how to make a homemade gas mask. So I'm not playing around, and neither is the governor. I mean, for what it's worth, he's a Republican, and most public Republicans really don't care about the Commonwealth, but he's one of the good ones. As far as I'm concerned right now, he's one of the good ones. And like I said, this is going to be a short live. It's not going to be too long. I just wanted to put this out there. Um, my prayers are going up for anyone that has been affected, um, anyone that has any concerns about this, and just protect yourself, man. Protect yourself, protect your family. Make sure you get the necessary things that you need so that you can better put a barrier between you and this virus that's going around, this manufactured, custom made thing that's going around, knocking off our elderly, our elders. Please do some research, pick up a book, learn where it came from, learn when it was first introduced into the public and when it was first a thing back in the day. Also, go do your research about The Simpsons. The Simpsons been put this out back in 1993. Um, so just know what you're dealing with. Know your opponent, whether it be virus or human or otherwise. Know your opponent, and that's all I really gotta say. My thoughts and prayers go out to everybody that's been affected by this, or anybody that's had concerns. I know it's a couple of cases popping up everywhere. The only place that's not confirmed to have a case in the world is by the South Pole, the North Pole, where it's extremely cold because viruses cannot thrive in that type of weather. So anybody else that does not live there, that lives in the United States and around the world, they did say that Greece, was it Greece? They shut their whole thing down too. It's basically at a standstill over there and stuff like that. The only thing that I think that they did allow open was grocery stores and hospitals. So that just goes to show you that a lot of other people are not playing. People are not waiting for the government. People are not waiting for Trump to get their shit together so that they can fix this or find a solution to this. You're seeing that a lot of the governors and the mayors of different cities and states are, being proactive and going through and doing what they need to do to protect their citizens. So, with that being said, thank you guys for tuning in. Everybody that tuned in, Keisha, Shan, thank you so much for y'all support. I really do appreciate y'all and everybody that tuned in. I will be back, but like I said, I've been doing a lot of running around. I've been doing a lot of getting it together, getting some things together and stuff like that. And hopefully, when things die down, I can come back on here and debut my new mic set for y'all that I got, because that's what I'm talking on right now. I hope it's crisp and clear. And I just thank y'all for y'all time. Don't forget to like, subscribe, and share. Don't forget to have a conversation about this because this is something that needs to be talked about and spoke on. Most definitely. With that being said, till next time, you guys, I will be back at y'all at a later time.